Welcome to the EPSA podcast. Today's episode, You Matter, a brief conversation on suicide prevention for students. It addresses a deeply sensitive but incredibly important topic. We understand that discussions about suicide can be challenging, but it's crucial to talk about it openly, especially in a student community where stress and mental health struggles are common. In this episode, we aim to raise awareness and provide support by shedding light on the resources and conversations that can make a difference. Our goal is to foster a supportive environment where you feel heard and valued. Remember, you're not alone, and reaching out for help is a sign of strength. But before we dive in, we want to issue a trigger warning. We will be discussing sensitive topics related to mental health and suicide. If you or someone you know needs immediate support, please reach out to a trusted counselor, mental health professional, or a crisis support service available on your campus or in your community. Thank you for tuning in and taking part in this important conversation. Let's get started.
Understanding and realizing the warning signs and risk factors in a person with suicidal thoughts is critical to saving their life. Early recognition can be the difference between life and death. By recognizing these signs and intervening in time, it is possible to ensure that someone gets the help they need. In general, warning risks are not well defined and can vary from person to person. This could be sudden changes in mood, feelings of hopelessness, worthlessness, or being trapped, and experiencing guilt, shame, or anger. Also, verbal cues, such as expressing that they feel like a burden to others, are also significant. In addition to them, other essential warning indicators include alterations in behavior. For instance, withdrawing from friends, saying goodbye, giving away important items, or making a will, taking dangerous risks, such as driving extremely fast, and eating or sleeping more or less. As well as recognizing the warning signs, knowing the risk factors is another vital thing to do. Risk factors that are closely linked to an increased risk of suicide include mental health conditions like schizophrenia, bipolar disorder, and depression. Substance misuse, trauma, and recent stressors in life may also raise the risk of suicidal thoughts and behaviors. And for the last but not least, social and environmental factors such as isolation, lack of social support, and exposure to suicide through media or in one's community can influence risk levels. By increasing and improving knowledge and awareness, we can better support and encourage individuals to seek professional help. In summary, acting to prevent suicide requires more than just identifying the issue. It also requires recognizing the warning signs and risk factors of suicide early on. It's about making sure individuals who might be having difficulties know they are not alone and providing a safety net for them. We can all contribute to preventing suicide and helping those in need by being aware and vigilant.
How are you feeling? It's a question that easy to ask but often difficult to answer. We all want to hear it from time to time, whether from ourselves or from others. Since it doesn't manifest itself like physical pain, it's hard to define how we feel. It waits for you to describe it, shape it, and bring it to light. Sometimes it's like fighting something we can see. That's why it's important to ask. Because asking provides a safe, nurturing space. Well, how we can make more effective to asking? We can use more empathic language, like instead of saying, I've noticed you haven't been yourself lately. We can try. It seems like you might be going through a difficult time. I'm here to listen if you want to talk. Or we can also remind them their feelings are important and valid. Phrases like, it's okay to feel this way, or I can see how challenging this might be, can be reassuring. Because, don't forget, your presence alone can be a powerful source of comfort. The other thing that is really important is remind them that they don't have to go through this by themselves. Emphasize that seeking help is a sign of strength and offer to help with a gentle language. Instead of saying, you should see a counselor, try, I believe there are people who can offer valuable support and guidance. Show them that there are people who really cares and wanted to help. Offer to accompany your friend to their first appointment or help them find a therapist they're comfortable with. Remember, your support can be a lifeline for someone who's struggling. But if you encounter immediate danger, try to calm down and act quickly. In that case, contact emergency service or suicide hotline and stay with them until help arrives. Let them know that their safety is the most important thing and that people want to help find a way through this dark time. Remember, your kindness and empathy can make a world of difference. Let's continue to be there for each other, offering support and understanding in times of need. Thank you for listening, and thank you for staying safe.
Welcome to the last part of our episode that we will mention some resources where you can turn to for help. If you or someone you care about is in a suicidal mental health crisis, there are many resources that you can call or text to talk with a trained counselor. All these are free and available 24/7. If you live in Europe, there is the EAP, which stands for the European Association of Psychotherapy. You can find certified therapists in your country and contact them via email or phone. Additionally, each European country has its own website and phone number, offering crisis support and counseling from specialists. Now, if you're a student, many universities often offer counseling services where you can seek help. You can visit your university's website or ask if such services are available at your institution. About mental health apps. These apps have been designed to help patients who are experiencing suicidal ideation. An example of such an app is the Suicide Safety Plan. Don't forget to reward yourself because you matter, you are strong and can get through anything. Life has its ups and downs, but every day, just by showing up, just by being here, you win. They can't rescue you if they don't know you need it. Ask help from someone you trust. If it's not your parent, it could be a friend. If not a friend, then a neighbor, a professor, or someone else. We are 8 billion people on this planet, so there is definitely someone out there who is ready to listen and help you. Mental health therapy is not like a common cold where you visit your doctor, follow the prescribed medication, and recover in a week. Reminder, these types of treatments often require more time, so don't get discouraged if you don't see results within a week. Give yourself time and be patient with the process. In conclusion, I would like to reiterate the words of someone who once said, "In front of you there is a mountain, and you are at the foothills. You cannot reach the mountaintop from there. To reach the mountaintop, you have to go through the mountain. Stay strong, you've got this."